Hi, my name is Nanette Scoggin. I'm a registered nurse at the Tompkins County Health Department.
Hi, my name's Karen LaSalle, and I'm one of the nurses with Tompkins County Health Department.
When we receive positive lab results from the local laboratory at the hospital or from the state laboratory reporting system, we identify individuals who have tested positive for COVID. Our job is to contact those individuals, chat with them, find out how they're doing, find out when they became symptomatic, or if they have symptoms, talk about their test date, and go into the fact that because they're now positive, we really need to get them isolated to keep them protected from other folks who they may expose, and also to find out from them who their close contacts are, because we do want to try to stop the spread of COVID.
The reason that we do contact tracing is that the health department, or oftentimes it is our partner at the state level called the virtual call center, one of us will follow up with each person who has been identified by the positive COVID case. The purpose of our follow-up is to notify them that they have been exposed to COVID. And then because of that, we talk about quarantining them. We want to make sure that they are not exposing other people, because you might have symptoms and be infectious to other people before you come down with symptoms yourself. So we want to make sure that we contact you, let you know, answer your questions, and also be sure that you are quarantined in a place where you'll be safe and have your needs met. And the reason for this is that the health department is tasked by New York State with the job of monitoring communicable diseases and to follow up to ensure that people are quarantined if they are contact, or that they're isolated if they're a positive case, and that we are limiting the risk of the spread of COVID. So we are involved with that. There's a process where we provide a formal isolation letter or quarantine letter. And then we are also the people that legally release you from quarantine. So that is why that you hear from the health department. And often we're asking some of the same questions or asking you for the same information as Cornell.
The Tompkins County Health Department does collaborate with Cornell Health for various reasons. One is if they receive a lab result before we do, they do inform us so that we can get working with the cases right away, especially if it's somebody who's maybe just got tested for one of their surveillance tests. We didn't get it yet through the state reporting, but Cornell happened to get it first, or this was a retest of someone down the road. So they do communicate with us on a daily basis, and they have a team that will work with us in terms of meeting the students' needs. What's important about being accurate, thorough, comprehensive, honest, total transparency, because we're aiming to get down to the nitty-gritty of what's going on. We're not there to do any penalizing. We just want to make sure we're capturing what's going on with you. If you do have symptoms of illness, please don't discount them as just being a seasonal allergy. I get this every time every year I get this. You know what? Most of the students I've talked with in the last year, when they've mentioned I have allergies, but they're testing positive for COVID. So you know what? Don't discount it. It really might be COVID. And as soon as you start feeling those symptoms, pay attention to when that happens, like the date. That date becomes important if we need to isolate you if you are a positive case. And if you're under quarantine and during your quarantine period, you start becoming symptomatic, let us know. When you get that daily text message asking, how are you doing? If you develop symptoms, please say, oh yeah, by the way, I started getting some sniffles. Be honest about that. We're not penalizing you. We just want to make sure we're covering all of our bases.
And the reason that we want you to be honest is because we want to make sure that we reach each person that may be at risk of coming down with COVID. We don't share your name. We don't tell them who provided their name. We just give a date that they were exposed. But if you're hesitant and you don't share these names and you think that you're protecting your friends, think about the fact that, I don't know, a week down the line, they may be sick and there may be others then impacted. So really you're hesitancy to report people right away is going to end up with more people being infected or more people being impacted down the road.